Jennifer Kern, she's a contributor for the Daily Caller and The Hill, to talk a little bit more about this. Good to see you this morning. Dr. Fauci, one of the top medical voices, saying he cannot guarantee safety of in-person voting in November. I'm just curious, is this a little extreme? Do we want to hear Dr. Fauci here commenting on the elections and what he possibly thinks? Your thoughts on that?
Well, Sean, I think you just hit the nail on the head as to why President Trump has opened up a second task force specifically focused on reopening the country. If we left this to epidemiologists, as brilliant as they are, as wonderful as they have been in keeping the American public safe, they're not going to be the best people to determine if America should open their front door again. And we clearly have to do that to get America moving again. Look, I think there will be a number of measures put into place at the ballot boxes in November. You already see a lot of states have the vote by mail ballots in place. You already see, large states like California already have that in place. And I think you're going to see across the country the registrars of voters across the country and the secretaries of state across the country who are in charge of this looking for creative ways to open up polling places with responsible social distancing. And I think Americans will rise to the challenge and turn up to the polling places.
Some officials are already talking about sending out absentee ballots to their constituents. Do we think this is going to be something that happens in the general election in November?
It's possible. You see President Trump talking about what a danger that is. And look, the Democrats, of course, came out right away and said, Republicans are trying to keep people from voting. Saturday Night Live even had a skit over the weekend saying Donald Trump's going to coat your ballots in the coronavirus. That's utterly ridiculous. But you do see here that there are some real numbers here that vote by mail does have a higher rate of fraud. I'll put some numbers to that. The Heritage Foundation actually discovered about 1,000 cases when they did a random sample where there were specific cases of voter fraud, and it wasn't insignificant. You're talking about ballots lying around at places that went to old addresses of folks. Those are scooped up a lot of times by Democrat operatives. I've had it happen in a swing state in Colorado. We had it happen in an election where people were gathering up ballots and harvesting them, and the news media reported they were potentially filling them out for the Democrat candidate there. Look, it's rife with problems. There's no way to confirm your identification is really you, that your signature is really you. So it is rife with a lot of problems. But I think, and I do hope, that by November, we will be long past this coronavirus crisis and be back to normal as a country.
I know we do. Richard Roth joining us now, Democratic strategist, also founder of the Roth law firm. Good to see you as well. Hey, Dr. Fauci on another Sunday show talking about a quicker shutdown would have worked. Take a listen.
I mean, obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated.
It is complicated because Fauci was on our very own Greg Kelly Reports telling us it wasn't a big deal. That was in January on record. So it is complicated, especially when you hear stuff like that. Richard, I just wanted to get you to weigh in on that.
Well, it is very complicated, and it's not a Fauci issue. Dr. Fauci has a team of scientists and lawyers. There's an organization out of the University of Washington called the Institute for Health Metrics and Evaluation. They, along with a team of doctors, decide what's best. And what's important is that the administration agrees with whatever these scientists decide. Dr. Fauci said yesterday, that in fact, they did not get on top of the problem when they should have. And the concern that we all have now is that they don't listen to the scientists again and they start allowing, like Donald Trump says, it's going to be a big bang. That's not what the scientists are saying. So the concern is that unless they listen to the data, the scientists and the studies, they're going to be right back to where we are. So it's a very scary thing. We're talking about, as Governor Cuomo said, life versus dollars. And really we have to, the paramount issue here is when is it safe and how do we do that? That's the paramount issue.
But Sean, if I may, look, there will be a time in America, and President Trump's been clear, he thinks it will be a rolling back to work mode, where you have some states back to work and maybe some hot spots like New York come a little bit later. But look, there will be a time in America when we have death and dollars at the same time. You have to imagine a news cycle in which America is getting back to work slowly, but we're also seeing a death count on the nightly news. And that's going to be a very complicated situation for our politicians and public officials to work out. And it's going to be very tough for Americans to see that unfold on TV every day. But that's going to be the reality. It will
I
be
think
both.
Jen, I think we agree on that. The most important issue here is to listen to the data and the scientists and the studies that are actually focused on this issue, because they're the ones we have to listen to. And Dr. Fauci yesterday said, we didn't do it in January, February, or March. Let's please do it now. And that's all he's saying. And we can't disagree with that. It's a matter of death. But Jen's right. It's going to be a tough weighing.
I got to jump in really quick. We're out of time, but good to see both of you. That's Jennifer Kern. She's a contributor for the Daily Caller and The Hill. Richard Roth, Democratic strategist and founder of the Roth Law Firm. Good to see you.